If something is genetic, the problem has to be there from the beginning.
True. But then when we are saying that the autism is increasing,
Yes.
what are the reasons?
If you look at it, the data, interestingly, 80 to 85% of the cases, they are regression cases.
Okay.
Then interestingly, these children have a very low nutrition in them.
Okay.
Their fatty acids are low, their phospholipids are low, their amino acids are low, their B vitamins are low, their zinc magnesium is low. If we don't even have enough proper nutrition, how will the body develop?
Correct. I feel at least in the major cities, there is some awareness. Parents are able to see that, okay, their child is slightly different, behaving different, or there are something that they need to see comparison with the siblings. But I come from tier 3 city. I'm sure that my mother will be like, okay, she's just lazy,
See, if you look at the past, maybe 60 years back or 50 years back, people were taking care of their health. They were responsible for their health. If a major thing happened, they would go to a doctor. But if you look at today's parents, we have become dependent on professional for everything. So that should not be the case. Only challenge that I see when they go see a doctor or a development pediatrician or a therapist, etc. Most of the time they are given an answer. Nothing major can be done. That's a problem for life. It is going to be there for some time. If with that kind of attitude from a healthcare system, then how much work you can do about it? If a child has a problem, family is having a problem.
True.
It's not easy for a family.
Yes.
So it's a family responsibility that to understand the baseline. If a parent is able to follow with us persistently, consistently, without a break, earlier it is, better it is. So we can safely say that we can pull them out of the problem.
Okay. Welcome to Health Commune, where we are shaping a healthier world by bridging the knowledge gap between people, doctors, and the healthcare industry, empowering better health for all. Today, we are joined by Dr. Ashwani Garg, a medical doctor specializing in functional medicine and focusing on autism, autoimmune conditions, and gut health. He founded the Functional Medicine Clinic and the Indian Association of Functional Medicine and co-founded many more ventures. In today's podcast, he will speak about autism recovery and much more. Thank you so much for taking out time. You're here for your work in Pune, but this autism, I think last time we discussed, it was 26th of Jan, and we thought we should speak about autism. For our audience, could you please just quickly tell us, Dr. Ashwani, what all you are doing? We talked about diabetes and reversal of diabetes last time. I'm aware about the functional medicine awareness work that you are doing. But quickly, where all your clinics are there, what all work you are doing, if we can start there, that will be really helpful.
Sure. Thank you so much, Dr. Smita, for taking out time and creating this awareness. So primarily, we work with patients who has been sick for quite some time, and most of them sort of given up by the system, says this problem will stay with you for life and nothing can be done. And
all the chronic diseases.
Most of the chronic diseases, and it's painful to see their pain.
Yeah.
And sometimes things are easy peasy. Easily we can fix it, but then people went behind the diagnosis, people went behind the big names of the disease, but nobody's looking at what is the problem. So this is where to find out what is the problem leading to a diagnosis where we work. Now, primarily autoimmune issues like psoriasis, rheumatoid, metabolic disorders, and a large part of our work is into brain disorders, and one of them is autism, ADHD, a little bit of a Parkinsonism and schizophrenia, a little bit of, not much, but largely into children we work with autism, ADHD cases.
Okay. I feel that large awareness started happening regarding autism when Tare Zameen Par, was there, and My Name is Khan came up. So Asperger's syndrome and autism related, people started talking. Is it because that autism is more now? Is it because we are able to diagnose it? Or we are able to identify, or is it seriously increasing, the prevalence is increasing, or is it something that we are doing wrong, that disease is more prevalent now? So what's your take on that?
So if you look at the data is scary. Probably 40 years back, hardly we would find, in our schools, in colleges, or in our buildings, we would hardly have any child, out of thousands would have one.
Correct.
But if you look at now, India, we don't have good data, but US data, 1 in 30.
Okay.
1 in 30 is having either autism or some characteristics of autistic features. So almost, it's a very, very high prevalence. So it cannot be that we have been diagnosing it. If a child would have a problem, you and me, our parents would observe. But in the last 20 years, the problem prevalence is increased dramatically.
Okay.
And there are reasons behind it. So it's not just diagnosis.
Okay.
It's a serious problem.
It's a serious problem. We should, we should be focusing. And one important thing which I feel that for Health Commune, when we talked about autism, I feel at least in the major cities, there is some awareness. Parents are able to see that, okay, their child is slightly different, behaving different, or there are something that they need to see comparison with the siblings. But I come from tier 3 city. I'm sure that my mother will be like, okay, she's just lazy, or she doesn't want to study, or she's just distracted. Especially girls, it's very tough for girls. And I think that's also a data that I was reading, that more boys we are able to still diagnose, but girls are able to mask their symptoms. So we are not able to diagnose girls with learning disabilities.
Right. So I think at least the kind of patients I work with, there's no way somebody can miss them.
Okay.
The amount of severity, they cannot go undiagnosed.
Okay.
Only challenge that I see is if a parent, and many of the parents that work with us, they work from the small places also. Remote places of India. And these are basic families. Only challenge that I see when they go see a doctor or a development pediatrician or a therapist, etc. Most of the time they are given an answer. Nothing major can be done. That's a problem for life. It is going to be there for some time. And with that kind of attitude from a healthcare professionals or healthcare system, then how much work you can do about it? See, if I tell you this, something we can do, some work we can do to resolve some of the symptoms or make them better or bring them out of the problem, then a parent is willing and committed and putting efforts towards it.
Correct.
If they go see a doctor and somebody's telling nothing can be done, then they sort of lost the hope and then...
Correct. And once the doctor will say, nobody will question again.
Nobody will question.
Especially in India, Bhagwan ne bol diya, that's the problem we face. But then when we are saying that the autism is increasing,
yes.
What are the reasons?
Right. There could be multifactorial problems, but if you look at the data, interestingly, 80 to 85% of the cases, they are regression cases.
Okay.
Now, regression means a child was doing okay as the normal development at the normal milestones till the age of year and a half or 2 years, 2.5. Then some incident happens, some accident happens in the sense that probably 2 vaccines were injected at a time. Or the child was given some antibiotics, or child had a viral infection, or child spent a lot of time on screens. Then they regressed. Then they were speaking mama papa, they became muted.
Yeah.
Okay, or their behaviors started popping up. They start becoming more aggressive, they self-biting, self-hating, those kind of behaviors which are very typical in autism or repetitive behaviors. So, to still some extent the child was okay. Then accident happened, then regression happened, then a problem started, then we diagnosed.
Okay.
So, interestingly, there's a large proportion of the children where regression has happened because of a pathology in the body, and if we work on the pathology, it's a large possibility that we can do a lot of things about that.
Okay. Coming back to why the prevalence is increasing. Earlier we used to say that this is genetic disorder. These are genetic disorders. Now, thankfully, we know that everything cannot be blamed to genetics, all the conditions. So what's your experience? Is it how much percentage is genetic? What are the acquired causes are there?
So, I think large part of the problem is acquired. In the sense now, if something is genetic, the problem has to be there from the beginning.
True.
Let's say language. From the beginning, they should not, even mama and papa should not be there. Right? Those cases which are regressing, there could be genetic issues in the sense of their poor detoxification.
Okay.
Okay. Our immune system is weak, but it does not mean that they will get autism or they should get autism. Right? They might be at a higher risk because of their genetics, but it does not mean they should have a problem.
Correct.
But if we take care of certain things, so I think large part of the problem is not genetic, rather epigenetic.
Yeah.
And this is where the work can be done.
Correct. So how exactly you are able to diagnose children? I'll take a step back and I'll ask, at what stage parents are reaching out to you? Right. What are the common problems that they see? Right. And how they reach to you then?
Right. So, now first of all, this diagnosis business. Now, diagnosis typically a description of the problem.
Okay.
It doesn't tell what is wrong. It is let's say child is having a repetitive behavior, child is having a speech delay, child is having some other issues. Based on those 3-4 behavioral things and outcomes of the brain, if not optimal, then we label them if that fits into a category. But that doesn't tell what is wrong, why it is happening. So sometimes diagnosis is not enough. Say that I have diagnosed and I'm good to go. No. Diagnosis is just the first step.
Correct.
Now parents who come to us, they have already a diagnosis and they have been running from pillar to post. They go to one doctor, another therapist, etc. And somehow either on social media or Facebook and all that, and say, okay, this guy is saying something positive about it, and this guy saying something can be done. And those are the guys who connect to us, or they see or relate what we see is there in the child. They sort of come to us.
Okay.
And interestingly, these guys are in big cities. These parents are in smaller places also of India. So because we work online, so it's easy for them to work with us.
Okay. And so you are saying that children, those who are already been diagnosed by someone, that probably there is a ASD or any kind of a learning developmental disorders, disabilities that are there. We don't call it disability; it's a disorder that we can say. So, but what about parents, those who are not aware, they are not taking their child to even a pediatrician, but children, they have problems. So how they are they able to see any signs in their children and then think that, okay, let me reach out to?
So I think that's a human thingy. Most of us, until a problem becomes so big that it becomes unmanageable, I don't go see a doctor, or I don't go see looking for a solution.
Yeah.
Most children that come to us, their problem is quite huge and pronounced, in the sense that as a family, you cannot hide it anymore. And as a family, you see that you start worrying, if I'm not there, what will happen to my child?
Correct.
So those are the parents who are looking for answers. And sometimes it's a mild problem, for example. And so, remote place, or parent is unaware. So in the sense that they don't even see a problem. Let's say somebody has a less learning disability, then usko थोड़ा दिमाग में कमी है बोल के छोड़ देंगे, फिर चलता रहेगा. We can improve that brain function also, but उनको पता नहीं है कुछ हो सकता है, और उनको इतना सीवियर भी दिखा नहीं है कि वो छोड़ देते हैं. लेकिन जहां पर वो प्रॉब्लम ज्यादा हो जाती है, अनमैनेजेबल, लिटरली अनमैनेजेबल, पेरेंट उनका लाइफ बहुत प्रॉब्लमेटिक है, वो लोग सोल्यूशन की तरफ देखते हैं.
करेक्ट. So usually, like learning related anything that is not going as per the normal children, if we can categorize it that way, for the lack of great words. School में जाने के बाद we actually get to know that there is something different for this child. But isn't it too late? Like child is like in school when the child is like already 5-year-old or 6-year-old. So is it not too late to actually start any kind of intervention?
So yes, if earlier we start, better it is.
Correct.
For sure. Let's say ब्रेन का डेवलपमेंट ठीक से नहीं हो पा रहा है, उसको कॉग्निशन में प्रॉब्लम है, उसको रीडिंग में प्रॉब्लम है, उसको वर्ड्स में प्रॉब्लम है, कहीं भी प्रॉब्लम है. यस, अर्लियर वी स्टार्ट बेटर इट इज, बट इट्स नेवर टू लेट. बिकॉज बॉडी हैज इनेट एबिलिटी टू रिपेयर, रीजेनरेट. देयर इज समथिंग कॉल्ड न्यूरोप्लास्टिसिटी. ब्रेन विल रिपेयर.
करेक्ट.
तो अगर बाद में भी आए तो कुछ तो कर सकते हैं. अगर 100% नहीं करें तो 80% होगा, 70% होगा, 60% होगा. So some positive at least we can bring about it. We work about.
Are there any top warning signs that we can speak on this platform, and then if these things are there, at least get one consultation done, something like that we can speak?
So first thing first is, initially agar child is not responding to name, for example, child is always crying. A child should be a happy child.
Correct.
Why would a child cry all the time? Right? Child is not sleeping well. They're always twisting, turnings in the bed. Restless all the time. They're running around. They're not settling down. Right? They're overeating. They're under-eating. They're over-drinking, excess water drinking, drinking all water.
Dehydrated.
They get scared because of certain sounds of, let's say, Diwali ke around, they get scared. Sensory issues. So those are typical things. Overeating is a very, very typical. They self-bite. They bite others. They chew on things which are not eatable. So these are the very, very common things that people come to us. They think it's a behavior, but then there's a pathology behind it. But at least from that, a parent can pick up whether more problems or even one problem. Right? Let's say till there was a regression happened. Child was speaking few words, but after them they became muted or they're speaking less after 1.5 years, 2 years. Probably these are some of the quick points they can pick it up.
Correct. Now, when such child is reaching to you, whether diagnosed or anything, usually, when the child is going to a mainstream treatment modalities, right, like जो हम pediatric way of managing the patient, वो रहता है. So they usually, it's more of a symptomatic, more of looking at no complication should happen, and then learning level पे they intervene. What's your approach? How you do? And I have seen your website about the recovery program. So how exactly that works?
Right. So typically standard approach तो क्या है कि अगर कोई hyperactivity है, we can give some drugs. Plus we say go to a therapy, either occupational, behavioral or speech therapy, etc.
Correct.
It's like training them to get better without understanding the pathology. In our case, we try to see why they get each of the behavior or why they have this disorder, or because of that there is a disability, in the sense that which can be fixed over a period of time. But today the child cannot communicate, child cannot speak. Sometimes they don't even utter a single word. Sometimes they utter words but they cannot communicate or they don't make sense. So basically we need to find out what is wrong in the body.
Okay.
Now when we look at research, there's enough data. They say fungal and yeast infections could cause a lot of problem. For example, one of the main issue parents comes to us is something called toe walking. Toe walking is actually child is on the toes. Now, when fungal infections are more, there is more oxalates produced. These oxalates goes deposited on the feet.
Okay.
If a child puts a feet on the ground, they feel pain. It's a response to the pain. They are on the toe. But because nobody knows or nobody looks into that direction, they say it's a behavior problem, and they forcefully keep telling them, no, to walk straight, walk straight. Sometimes they can take the pain, sometimes they don't take the pain.
Yeah.
For example. So if a child comes to us, parent comes to us, we want to test which infections are there.
Okay.
And if these infections are present, these oxalates are present, and we then give them solutioning around reducing infections or reducing production of oxalates, and how do we clear these oxalates. And similar issue is eye poking with the oxalates. A child is poking their eyes.
Yeah.
It's a painful thing that is happening, but we think it is some problem with the behavior, but actually it's an oxalate causing eye poking.
One thing is कि if a child is, parents are reaching out to you, root cause analysis is what you are talking about, right?
Yes.
Like finding out where the infection happened or any kind of inflammation that is there in the system. How much time it will require to find out the exact cause? Because parents needs to have patience to understand what's wrong with my child.
Yes. So it's a long journey. Now, typically testing we do, it takes 7-10 days to get the reports and etc.
Okay.
And after that we analyze these reports. Not that these reports will give everything, but broadly gives us a direction.
Okay.
There are chronic infections in the body which is affecting the gut, which is affecting the brain. There are toxicities, especially heavy metals, and probably microplastics is another one we should look into.
Yeah.
We should use your help in that case.
Sure, we'll do that.
Heavy metals which are neurotoxic, immunotoxic,
Okay.
mercury, aluminium, lead, arsenic, barium, etc., etc. Then interestingly, these children have a very low nutrition in them.
Okay.
Their fatty acids are low, their phospholipids are low, their amino acids are low, their B vitamins are low, their zinc, magnesium is low. Baseline nutrition is very low. Now, it's a developing child, growing body. It has to repair, regenerate and grow. If we don't even have enough proper nutrition, how will the body develop?
Correct.
Repair, regenerate, forget about it. Okay, so that is why this whole sequence of growth is halted.
Correct.
So we look at all these things. The liver markers are actually a big problem. Many of them, the OTPTs are very high because the gut is bad and gut microbiome producing a lot of toxic waste affecting the liver health.
Okay.
The detoxification is compromised. And many of time these children are autoimmune in nature, in the sense that we are not able to test their autoantibodies for the brain.
Okay.
Not possible in India, but in outside India, a lot of people are working on this part. But at least in India, we test their ANA and anti-CCP.
Okay.
Now they don't have a joint pain and all that, but their ANA and anti-CCP are in a range which is an autoimmune condition itself in them, but that is not affecting the joints. at that point of time, but at least we get a reference that their body, their immune system is haywire in a state of autoimmunity. And then if we test more antibodies, probably we'll get a more picture clarity. So this typically process can take maybe 10 days, 2 weeks. And then we process the reports, we analyze the reports and tell the parents this is wrong. And these are things they need to do over a period of time. We cannot fix all the things at once. So slowly, gradually, one thing at a time, we keep doing.
Okay. And is it very expensive to do the root cause analysis?
Not exactly. See, earlier, a lot of the people who work in the similar fashion, they would run all the tests in US. Then it becomes expensive.
Correct.
At least, 60,000-80,000 rupees per thing. But now we do most of the testing in India. There are labs, good labs in India also.
Correct.
So give and take 10,000-12,000 to 15,000 rupees for 3 months.
Okay.
So we do test every 3 months. So we can track how the child is changing, how the improvements are coming, plus how the markers are improving.
Correct.
So it has to be sort of parallel, linear path.
Correct.
In the sense that
still quality evidence based.
Yes, absolutely.
Yeah.
So we keep doing every 3 months. So 10 to 12K or 15K every 3 months.
That's fair. Initially all these high-end investigations, we used to send it abroad and we used to say that it's not possible in India.
Yes.
But now good labs are there.
Yes.
So once the child will be knowing that, okay, this is the root cause and these are the things that we have to start fixing, how the family should actually react to this? Like parents, is there acceptance issues or how exactly, what's your experience with that?
Right. See, they are willing, more than willing. They know the problem already because they have already been going from one place to another place.
Correct.
They are already knowing that they have to fix it and something is not right with my child. Now, when they come to us, our path is not easy. In the sense, we don't say go to a therapy center and parent is easy going in that period. It's not life of parent is not easy.
Correct.
Okay. But we say, okay, these are 20 problems, 30 problems are there in your child, but we cannot solve all of them. But we start with the baseline. You change the diet, you change the lifestyle, start with that, and a little bit of a supplementation. What are the missing things in the body? Then slowly, gradually, we start cleaning out the system from the infections, from the toxins. That's the first level of things we do. Now, because change is always tough. Parents want to do it, but change is tough. And sustainable change is even more tougher. Some parents do it for 1, 2, 3 months, then they sort of give up. And some persistent guys, and they who has that in them, they're doing it for at least 1.5 years to 2 years, and they gradually every 3 months, every 6 months, they keep seeing that new things are happening with the child. What they have lost in the regression is they're regaining most of the problems, getting better.
Okay. And what's the results you are able to see? Like if we talk in terms of percentage of children, those who were able to recover.
Yes.
So what's your experience in that?
So I would say, if a parent is able to follow with us for at least 9 months to 1.5 years, persistently, consistently, without a break, 80% of the children, and when they come early to us in the stage of, let's say, 3 years to 6 years or 3 years to 9 years, earlier it is better it is. So we can safely say that we can pull them out of the problem.
Okay. And it is like once assume that like somebody who's very, very dedicated, parents are very dedicated, they are religiously taking care of a child for 2 years, change their lifestyle, change siblings' lifestyle, change the whole family lifestyle, to be aligned with something that will help the child, who probably have some kind of a thing and who's going through the complete treatment with you. Now in that case, after 2 years, how frequently they need to do the follow-up?
See, again, once the problem is settled, okay, language has improved, muted child has become communicable child, their behaviors have settled in because the root causes are settled in. So once in 6 months, if once we have repaired the car, we just have to keep maintaining it.
Correct.
Now, initially, probably every 6 months, if we run one round of testing and see what are the parameters, if any small interventions are required, we can do that. If not required, we can let them be. Just, it is important that they maintain a healthy lifestyle and food. At least that should continue as much as they can. And large part of the treatment can be off.
Okay. It's just the thought that is coming. I haven't researched on this. But still, like, we are talking about triggers that happened at the childhood, and that could be reason, that all these symptoms are exaggerated, or some cause that is there.
Yes.
Now we know that in our complete life's journey, there are multiple triggers. Like if we are talking about girls, we are talking about the menarche. We are talking about probably later higher education,
Yes.
stress related to that, marriage, children, everything. Are there chances that something relapse will happen in life?
So now, at least from that sense of development, if child we have given a optimal nutrition, optimal conditions for the development, child brain will optimally develop as it should have been,
Correct.
which was halted earlier, but now it has gone to the normal level. Now, once that happens, then it's just like you and me. Anything else can come. We all can get into, let's say, dementias, early dementias if we don't take. We can get into diabetes. We can get into all sort of problems if we don't take care of ourselves.
Correct.
So that same applies, but I would not say that they will lose their language again or they would go nuts again. They will maintain their health and they will continue to be healthy.
Okay. We are talking about, like, earlier it's a better, and it's applicable for any medical condition.
Yes.
Here, if somebody is already assume they're in their teen or adults or grown-ups, but we know that probably they are taking a mainstream treatment for autism or any kind of a learning disorders. What kind of chances are there that they will still be able to see some hope?
Right. So we have worked with elderly children where 22, 36, 38. Now we can make some difference in their life. Because, see, it's not about that we cannot solve. It's about, it becomes even more tougher for a parent to do anything about it.
True.
Right? If you have to do a dietary change, very tough. If you have to follow some supplement regime, very tough. Because younger the child, parent can control a lot of things. At that age, control is not easy. Right? But if still some committed parents, we cannot say that safely all problems can be taken away, but we can stabilize them.
Okay.
That much can be done.
Okay. What about the severity of autistic symptoms or the spectrum?
Yes. So now, good question you asked. Now, initially a child might be diagnosed with the mild problem. Now, sometime it is a thought a parent can think that mild will remain mild throughout, moderate will remain moderate throughout, or severe will remain severe throughout. No, it's a dynamic encephalopathy in the sense that as the disease will grow in the body, pathology will grow in the body, the impact of that pathology on the brain will increase. So a mild can become moderate to severe over a period of time. And sometimes as hormones kicks in, it becomes more tougher for a child. Reverse can also happen. Severe can become moderate to mild, and of course out of the spectrum also, if we take care of them.
Correct.
If we eliminate what is causing the problem, then the sort of disease will regress.
Got it.
If problem will increase in the body, then child will regress.
Okay, that's interesting. You have the program. Is it specifically for autism or other learning disabilities? And one thing I definitely want to ask about is ADHD, right? Like, because of probably the internet, everybody thinks that the child who's active is having ADHD, right? It's like people, those who like cleanliness, they have OCD. Similarly, child who's active is ADHD, and that's how everybody thinks. Like, I feel overdiagnosis is happening too much because of the internet. So tell me a little bit about the other conditions as well.
So now, if you ask me, we are just trying to make them healthier. And this body is capable enough to solve its own problems. So whether a child comes to us with autism label or ADHD label or GTD label, we would not mind. Our job is to find out what all things are wrong in the body.
Okay.
We're just trying to make their body and system healthier and create those conditions so that body can develop normally as it should have been and take out the problems in the system. So all problems will start getting better. Now, interestingly, this ADHD case, which is becoming more common in the teens also.
Yes.
If you look at the gut health, many of them will be bloated. Many of them will have IBS kind of situation.
Correct.
Okay. And
the sugar overload, right? All the candies and everything.
Exactly.
Yeah.
So it is a diet they're eating causing the growth of certain microbes in the body, especially yeast and fungal and Clostridium infections, or antibiotic, multiple dose of antibiotics will cause more Clostridium in the system. that will impact their neurotransmitters. Their dopamine metabolites keep high, and the calming metabolites becomes less. So if we can balance these neurotransmitters, either we straight away balance the neurotransmitters, you can give GABA or theanine to have more inhibitory neurotransmitters to balance the excitatory neurotransmitters, then some calmness will come, ADHD will get better. Or if you also alongside you change the diet, lifestyle and clean out these infections which are thereby affecting the neurotransmitters, you clean that out and ADHD is taken care. Is again not a problem for life.
Correct.
And most of the time what do? We give them a symptomatic relief. We give them some drugs, which is fine. Short term it's okay. Any drug, short term emergency is no problem. But then emergency drugs becoming a lifelong drug is a problem. So rather we look at the problem and solve the problem.
Correct. Do you think, like, I don't know globally how it is happening, but do you think there is a need of school programs where we'll be able to screen the children at early stage? Because we cannot go home to home and we are not able to go home to home and give vaccination. Do you think there is need, and that will solve quite a many problems if there are some school programs like this?
So I think yes, as the number of children are growing with the problem, this prevalence is scary. So yes, if teachers and school staff is more aware, they can inform the parents that something is wrong and you need to see what needs to be done further.
Correct.
But more importantly today, even if we get a label, what do we do? Most of the labels, same standard treatment that is given today is a therapy. That doesn't cut through.
Correct.
So it is also important that we educate our healthcare professionals. These are things that you need to be doing.
Correct.
Baseline food at least. I know in our medical system, we think diet and lifestyle is a joke.
There is no subject for nutrition.
Exactly.
Yeah, we don't. Right?
Our bodies are made of the food, but nobody is teaching us that.
Correct.
It's not, even if a tiny page.
It's not there. Even in biochemistry, we directly learn about protein, carbohydrate, all the cycles that are there, but we don't study what we consume.
Yes.
It's there in PSM, we do study little bit, but we study for malnutrition majorly or parasitic infection related thing. We don't. It's not a part of medical curriculum.
Exactly.
It's not. Yeah.
So at least our health, along with the awareness in the sense picking up the problem early on so that we can fix the problem early on, we should also equip our healthcare system. If a person comes to us with the problem, we should be able to solve the problem. Rather than being a standard game.
Correct.
Now it's diagnosed, you go to a therapy. Therapies are fine. It's more of a training system.
True.
No, but how much training you can do? If my brain is incapable to understand your question, to respond to you, you keep posting me 100 questions at 200 times, you keep telling me the same things, I would not, this is not getting registered to me because my brain health is metabolically poor.
So, where do you think the awareness should be there? Is it primarily, and you and me being a doctor, we can speak about doctors. For doctors, the awareness is most important, followed by people, so parents.
Yes.
Then we are talking, because we are dealing with children, we are talking about schools. Where the impact will be largest? Where do you think the impact will be highest?
See, if you look at the past, maybe 60 years back or 50 years back, people were taking care of their health. They were responsible for their health. If a major thing happened, they would go to a doctor. But if you look at today's parents, sorry to say that, okay, we have become dependent on a professional for everything, right? So that should not be the case. A parent should be knowing what to feed them, how much screen time to give them or not to give them, how much sunlight to be given them. They should be knowing these baseline things.
Correct.
Because we have more money, we're giving them all chocolates and sugars and candies and just as a, as a love for them.
Correct.
But we're damaging their health. How many children, they have normal teeth today? I'm 40 today. I never been to a dentist so far. Okay. And it's very, very uncommon for a lot of my friends. They think, oh, you haven't seen a doctor, dentist yet. Teeth are okay.
Yeah.
Right. So, parents should be knowing the baseline things at least. If before pregnancy, for example, what are the things a mother should be doing? how to make herself healthier. That's first thing.
Yes.
Then during pregnancy, what are the things she needs to be doing?
Correct.
And after pregnancy, these and how the child care. A mother should be knowing all of this, or family should be knowing.
Correct.
Then probably incident will reduce dramatically.
No, I'll take a slightly different approach, because mother is already doing so much of heavy work, right? Then I think the education part should be given it to the father.
Absolutely.
Because I am a mother and I know that, of course, what I have done and I want to promote this as well is planning the pregnancy than actually becoming pregnant and then celebrating it kind of a thing. So your body should be capable enough to actually get another human in this world, right? So at least 6 months you have to be nutritionally good.
Yes.
You have to make sure your sleep is good and organized. And also I resigned from the job. I was sitting at home. I prepared myself for the child and then I thought that I should think about a child. Because of course being a doctor we know. But I feel that, but yeah, like India, मतलब लोग तो ऐसे pregnant हो जाते हैं. But then mother is already doing too much of heavy work. Yeah, go on.
See, it's a responsibility of the family. Let's put it
Yes,
that way. I'm sorry to put the blame on the mothers.
Yeah, father भी कुछ तो काम कर दे दो, होना चाहिए.
Absolutely. No, it is important. See, if a child has been a problem, family is having a problem.
True.
It's not easy for a family.
Yes.
Okay. So it's a family responsibility that to understand the baseline. Health is, see, we all designed to be healthy. All of us are designed to be healthy. Newcomers are also designed to be healthy.
Yeah.
Nothing wrong with the genes. Okay. Most of us, nothing wrong with the genes. It is only pure lifestyle, poor food, the binging the Netflix at night and, not getting enough sunlight. Baseline, water is bad for us. Okay. Hydration is not happening.
Correct.
Even if we fix the base things for ourselves, half of the problem is just taken care, just like that.
No, your clinic is in Bangalore.
Yes.
So is it like, but you do majority of work online.
Right.
How that exactly works? Like all your root cause analysis, everything can happen online, right? Like I don't need to send a patient to Bangalore if I need to refer.
Correct. So now it takes a lot of time for us to analyze the child.
True.
We don't want a parent traveling all the way to Bangalore and then I see them for a few minutes and then send them off. Doesn't make sense. So all the testing we try to have arranged home sample pickups.
Okay.
One is the blood test where we use some labs, existing labs. The guy will go home, pick up the sample. Then some testing is kit-based test, organic acid, microbiome testing, or some genetic testing, or some hair testing. The kit will go home. The parent will put the sample into it, then prepare it, and it goes to lab.
Correct.
Then we have enough data about the biomarkers. Then we send them a Google document to capture all the problems of the child. Now, I cannot ask 100 questions and the parent might not be knowing 100 answers right away if I ask them. But I give them enough time. It takes 1 hour, 1.5, 2 hours. They can analyze all the problems of the child and they are with the child. They know all the problems of the child. They give me the data, what are the problems the child is facing. Then I combine this data. I put the data together. These are the markers. These are the problems. And then we come up with the potential reasons behind it. Is it the mitochondria? Is it the infection? Is it toxin? Is it liver not doing okay? Is thyroid not doing okay? Is some of these children have diabetes also, by the way.
Wow.
They're metabolically poor. But because they have a diagnosis, nobody cares about that. So we try to analyze what is wrong. And then we, step-by-step manner, we come up with the action plan.
Okay.
Dietary modifications, lifestyle modifications. If infections are there on the test, then how do we clean them out? Slowly, gradually, what kind of probiotics to be used? Then, if toxicities are there, we start with the baseline, basic nourishment in the body, improving liver, etc. Then, if required, we do chelation. Okay. Next level, now we are using a little bit of a regenerative medicine also, where something called peptide therapy.
Okay.
So peptides are sort of signaling molecules. They can these are biosimilars. The body is producing these peptides already, just like insulin.
True.
But because of the disease, because of the disorder in the body, probably the amount of peptides produced by the body is not enough. Thereby, repair regeneration is compromised.
Okay.
So we can use to strengthen the immune system, to strengthen the gut function, to strengthen the brain health. So these different peptides are available. Then sometimes we can also use a little bit of a regenerative medicine, so cell therapy. We can use exosomes secreted by the stem cells. We can inhale them, nebulize them. They send the signals to reduce inflammation in the body and do a little bit of a repair work also.
Okay. But so that cannot happen at home. So
nebulization can happen, but if we have to do injectables, then we have to take them to ICU setting under a pediatric doctor guidance, and we can do that. So basically, we cover a whole spectrum of things, whatever it takes. Some they start seeing results with the baseline, food, lifestyle, they start seeing, but some we have to go next step, some another step. So whatever is required, we do that to bring the child out of the problem.
Okay, and online it's majorly like even 90% of the things are possible online. So nothing should stop us if we are like, I think every parents want their child to be perfectly, live a healthy life and happy.
Absolutely.
That's more important. If the child is suffering somewhere, it's not able to adjust, then it's important that you reach out to a right doctor. And I always appreciate functional medicine way of dealing with the chronic conditions, root cause analysis. I think today if I want to do that course, first thing I'll do is to do that course, like after my MD if I want to. So I really respect the way you try to solve the problems. It's very tough for other professionals or normal people to speak anything about medical profession. But I personally, I'm a pharmacologist, I'm the drug maker. So, but still I feel that looking at the way, this prevalence is increasing and we are sitting with diabetes overload, we are talking about every child and every parent is saying that, okay, either my child have ADHD or some kind of a thing. It's very important that we look at the way functional medicine approach. We look at the root cause analysis, we look at taking our nutrition seriously, and sleep and earth and water and like very, very basic things. And I always appreciate whatever you do, and thank you so much for coming and discussing about anything. Any message that you want to give it to our audience who will be listening?
Right. So autism or similar problems are not supposed to be lifelong problems. If we work hard enough on them with the right practitioner, with the right approach, for a long enough time, sustainable efforts, the child can come out of it. Okay, it's not impossible. It is tough, not impossible. You should be ready.
Yes. And we are calling it as a recovery, right? We can recover. Autism as a condition.
So let's say, just to last thing for the parents, the repetitive behavior, communication, and socialization. These are three things typically the hallmarks. If we improve hormones, especially oxytocin, okay, as we improve the microbiome, the oxytocin production will improve. Then socialization will improve. Out of the two things are gone, that means half of the diagnosis is gone. And communication, if I improve the brain health, the speech centers are improved, then language communication is just the outcome of that. Right? As we improve the neurotransmitters, repetitive behaviors will also get better. If we solve this complex problem, break them into three parts, one by one I solve it, then there's no more diagnosis.
True.
Then we can say it is recovered.
Correct. Yes. And no, we should say that. Though I don't think that it's written in our textbooks. But there is no harm in saying that. And you have already treated so many children. You are helping so many parents. You have the data as well. And we have the results as well. So why not to say that? So I'll be very happy to say that it's possible to recover autism. And many more learning disorders.
Absolutely.
Okay. And such a great thing to talk about, right? Thank you so much for coming on our show, if I call it a show. And let's do more work by creating awareness.
Sure. Thank you. Thank you so much.